control than anyone, including your doctor. Diane?
Hi.
You gave us quite a scare on Tuesday. Life flight and all. You look like you're feeling better.
Yeah, I am.
I'd like to take a few minutes and talk to you about...
About what?
About how you could better manage your diabetes.
Oh, you mean the blood tests and all that medical stuff? I know how to do that.
And managing your diabetes has more to do with how you think and make decisions than it does with just the medical stuff. Now, today, I want to talk to you about intake.
Excuse me, but I know how to manage my disease. I do not have a problem. Okay, I had a small problem. It's not going to happen again. It's no big deal. I don't worry. Millions of people have this disease, right? I've made it this far.
Yes, you have. Barely.
Look, I know what to do. I mean, why should I change my lifestyle? When I feel normal. I will be careful. And I exercised the other day. So what is it you wanted to talk to me about?
I want to talk about your health, not your illness. Your eating.
But I feel fine now.
And you're a young grandmother. This sometimes happens to people your age, your weight. But 4 days ago, you were in an accident that was brought on by your disease. Could have cost you your life. Could have cost somebody else theirs. You've got to make some changes.
Okay, I'm sorry. That's not going to happen again, I promise. So now what?
And please, listen to me. You are in denial about your diabetes. You do have a problem.
But, you know,
Just hang with me for a moment. I just want to ask you one question. Who is the most important person in your life?
My husband.
No. No, I don't think so.
My family. And my grandchildren.
All right. If I were to ask your husband or your family who the most important person was, what would they say?
Me?
Right. You are the most important person in your life. You're the only one with responsibility for your life. You have more control than anyone, including your doctor. You have got to start thinking about you. Just ask yourself this question, Ann. What if
What if what?
What if you don't take responsibility for your choices and actions? So you've got to focus right now on the inside, on your mind, as well as on the outside. Your mind controls what you do, and what you do is up to you. Now look, when you go home, I want you to put this up on your refrigerator door. If it's to be, it's up to me. I've got another one in my kitchen. It says, if you continue to do what you've always done, you'll continue to get what you've always gotten. Now look, the other day, you binged. And you drove home when you shouldn't have. And you wound up in the emergency room.
Well, I just didn't want my friends to know I was diabetic. I just wanted things to be the way they used to be. I just didn't see much harm in just one night. Besides, you know, I should not have to change my lifestyle. That is not fair.
No, it's not. But you do have to start going in the right direction. And you won't do that if you keep making wrong turns. You do have to change your lifestyle. And only you can do that.
Okay. Okay. You're right. I'm beginning to understand that I have got to start taking care of myself. Okay. I know I have got to start making some big changes.
Okay. Remember, it's all about how you think. When you sit down to eat or drink, think first what's best for your body, not about what'll taste good or what'll be the most fun. And do remember these 3 basic actions. They're deceptively simple, but they're critically important. Number 1, be aware of an upcoming critical moment, just like when you're about to cross a busy street. Number 2, recall your glucose and A1C numbers. And number 3, carefully evaluate your choices of food and drink, and then decide. Okay? Now, let's visualize a tough situation. You're out to dinner with new friends.
The food is fabulous here. Hello, folks. Would you like something to drink? How about a bottle of wine?
We'd like a bottle of Cabernet Sauvignon. Is that okay with them?
I love Cabernet. That's my favorite. Wait a minute. This is a critical moment. I can't drink.
Good. You'll love this. It's Napa Valley. We'll have this one, waiter.
Excellent choice.
Excuse me, waiter. Tonight, I think I'd better have an iced tea.
Just bringing the wine. Tom's driving tonight, right? I mean, it's only one glass. It's good for you.
Thanks, but no thanks.
You're not pregnant, are you?
Well, what do you think? I'll have the iced tea, please. Thank you.
Good. You were aware of the upcoming critical moment, and you dealt with the alcohol issue. You know that alcohol is the worst thing you can consume.
Okay, we better order now.
Let's see, my numbers. Glucose, 150. A1C, 8. Oh, numbers are high. I gotta be careful. Okay, number 3. Evaluate and choose. Low carbs, high protein. No pasta.
They have great spinach lasagna here.
Thanks. No, not tonight. Potatoes, definitely no. Tiramisu, don't even think about it. Okay, entree. Hey, fish. Salmon. Okay, I'm ready.
Lasagna, right?
Sounds good, but I think I'd like to have the blackened salmon tonight.
Baked potato, French fries, or mashed?
Gee, rub it in, why don't you? Let's see. Evaluate and choose. What other vegetables do you have?
Asparagus, carrots, and I believe broccoli.
Okay, I'll have the asparagus.
Well, I'd like to propose a toast to good friends and good food.
It will be difficult only if you fight it, if you think about it, accept it, and organize it, and you can conquer it. And that feeling of victory will help lessen the stress. Beware of eating to cover low mood swings, anger, depression, boredom, eating for any emotional reason. Again, it's up to you. It's your responsibility. You know how to motivate yourself. Fear is one way. There are better ways. Positive images, pictures of your grandkids on the door of the refrigerator, or a picture of yourself at your perfect weight. Make a little card with those 3 actions I talked about and carry that card with you every day. Remember, how you think is so important. Keep your mind off what you don't want and on what you do want. Don't think about sickness, think about health. Set some realistic goals for yourself and make a chart so you can see your progress. If you can see where you're winning or see where you need to work a little harder, that's good motivation. Do you remember the basics? Can you tell me what they are?
Oh, well, let's see. Be aware of an upcoming critical moment. 2, recall my glucose and my A1C numbers. And 3, evaluate my choices for food and drink, and then decide. And finally, take more responsibility for my health.
You're giving your family a gift. So what do you think of our plan? And if it's to be,
It's up to me.
you have more control than anyone, including your doctor.